Welcome everyone to the National Fellow online lecture series. The topic we will discuss today is equestrian medicine. My name is Dana Sheng. I'm a sports medicine physician at Dignity Health, and I will be your moderator for today. The lecture series is sponsored by the AMSSM Online Fellows Education Subcommittee, co-sponsored by the Education Committee and the Fellowship Committee. These lectures are meant to serve as an adjunct to your individual fellowship program education. The goal is also to provide sports medicine fellows with direct access to learning from experienced AMSSM members and at times invited guest speakers in a variety of formats. Finally, this is also meant to assist in CAQ exam preparation. Make sure to mute your microphone and turn off your video. You can submit questions at any time through the chat function, and feel free to include your name and program if you wish. At the end of the talk, I, as the moderator, will ask the questions during the Q&A based on the questions you submit. After the program, please complete the evaluation, which will be put in the chat at the end of the lecture. And now I'd like to introduce you to our expert speaker today, Dr. Jacob Miller. Dr. Jacob Miller is a primary care sports medicine physician at Sanford Aberdeen Medical Center and head team physician at Northern State University. He's also a clinical associate professor in the Department of Family Medicine at the University of South Dakota Sanford School of Medicine. He also serves as the team physician for Central High School and other area high schools. In addition to clinical medicine, he has conducted research on injury and exercise profiles of professional rodeo athletes, horseback riding biomechanics, and sports medicine physician concussion practices. In his spare time, he enjoys playing violin, guitar, team roping, and spending time with his family. With that, welcome Dr. Miller. Thanks so much for being here.
Hello, my name is Jacob Miller, and I'm a primary care sports medicine physician with Sanford Health in Aberdeen, South Dakota. It's a great pleasure to be speaking to the National Online Fellows Lecture Series today. I hope you enjoy our presentation entitled Equestrian Medicine, Terminology, Treatment, and Tack. This is a topic that holds great personal meaning for me, having grown up on a ranch in northeastern Nevada, and I'm excited to share these new things with you today. I have no relevant financial relationships to disclose at this time. However, once again, I did grow up on a ranch. Much of my background is in Western riding. And so some of this topic will be skewed towards that style, but we are going to talk about the other styles of riding as well. Our objectives today are to become familiar with some common terms and the equipment that's used within equestrian sports. We're going to discuss the biomechanics of riding, including ideals of posture and form, and some common pitfalls that may predispose to injury or pain with riding. We're going to review the inherent injury risk associated with horseback riding, as well as some training that can be used for riding performance and injury rehab. And lastly, we're going to review the benefits of riding and a cross-training potential that exists. So why are we talking about this? Why is this important? Because about 10% of people in this country are going to mount a horse for either pleasure or work within this year. This is a lifelong sport. Many people take part in it, generally within the 4th and 5th decades of life, but it can be a lifespan kind of sport. Many of us are most familiar with the rodeo horseback riding, maybe horse racing, or the English hunter-jumper styles of riding, but there's a very wide range of horseback riding that we can engage in. Some of my favorites include, down in the left-hand corner of the screen, this thing called horseball, which is kind of like polo, except there's no mallets. And then in the Middle East, there's this sport called tent pegging that you see over here that's kind of like jousting, except your target is right next to the ground. So there's lots of different ways a person can be engaged in horseback riding, besides just those that we are most familiar with. When we see our patients in clinic, they're going to use some different language, and it's important that we be somewhat familiar with what they're talking about. Let's start by talking about the common horse gaits. Your patient may say that they were trotting. This is an essentially 2-beat gait where the horse lifts each diagonal pair of legs alternately. Perhaps it's better to think of these with the sound they make. The trot makes more of a trip, trot kind of a sound as the horse marches along. The faster gait to that is called the canter or lope within Western parlance. And this is a three-beat gait that's somewhat complex to understand. It starts with one of the horse's hind feet hitting the ground, followed by the opposite hind foot and the ipsilateral front foot, and then by the contralateral front foot. This has more of a three-beat gait, like I say, more of a tiddle-lump, tiddle-lump, tiddle-lump kind of a sound to it. The fastest horse gait is what's called a gallop or a full lope. Once again, this is a three-beat gait, but it's more of a tiddle-lump, 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 tiddle-lump kind of a cadence. Once again, with that three-beat gait in which all four of the horse's hooves are off the ground, as seen here on the bottom right-hand corner of the screen. Your patient may also talk to you about how they were sitting on that horse, what's termed a rider seat. The three-point seat is one in which both the ischial bones and both knees of the rider are in contact with their saddle. This is commonly used within either walking or a slower trot. Now, a half seat is what's used with that either faster trot or perhaps the canter, in which the knees are in contact with the sides of the saddle, but the ischial bones are off the saddle, but the clothing is still touching the saddle, so it's not all the way lifted off. Really, you're kind of poised there at that halfway point. And lastly, there is a two-point seat in which the ischial bones are all the way off the saddle, but only the knees are in contact. And this is used for a canter, a gallop, or also seen in jumping as well. Your rider may also refer to something called posting. And this is used to take some pressure off of the horse's back. It's more of a rhythmic rise and fall that this rider is using, trying to move within the rhythm of the horse's gait, where they're going up and down, up and down, up and down while that horse is moving, usually in a trot. We're going to review some of the equipment that's used during horseback riding. The most common part of that equipment is our saddle, of course. On the left is the English saddle. On the right is the Western. You can see that there's many similarities between these two styles. Each has a seat, each has a stirrup, and then a knee pad or a fender to help cushion the sides of the legs. Some obvious differences between the two. The Western saddle will have the horn that rises up there on the right-hand side. And this is used for after one has roped a horse or cow to take some wraps of the rope around the horn in what's called a dally, and this helps the rider control the animal that they've caught. Another very important part of the saddle is what's called the cantle, and this rises up and back of the seat. This is used to help to cushion the lower back, and sometimes is implicated within back pain in horseback riding. When we're talking about how to interview horseback riders, I like to use the clinical baseline of how would you interview your running athletes? What kinds of questions would you ask them? Because oftentimes horseback riding can be somewhat of an endurance sport. So you need to know, was this something that happened acutely, or is this more of a chronic issue? Let's say that the patient comes in and they said that they were bucked off their horse, or we'd want to know what that mechanism is for the injury that happened just suddenly like that. How is it impacting this person? Are they still able to ride? Can they mount their horse because of it? Is there some kind of a time constraint that they're under? Do they have a competition, maybe a jumping show? Do they have a rodeo this weekend that they need to get back to? And if so, are there any kinds of modifications to their participation that we should be considering at helping it back on the horse? Otherwise, this may be something chronic that's been going on for a long time. And just like with runners, we want to ask, how long has this been going on? Was there any kind of event that caused it to come on? Any aggravating factors, alleviating factors? How long into riding does this pain start? Is it right off the bat, or is this something that happens after about half an hour of being on the horse? And are there any horse factors that play into this? Are there any equipment factors, such as the saddle or boots, that may play a role in this? Now, your horseback athlete may come in with a very different sport than we're used to seeing, and so it's important to ask questions to understand exactly what demands they are under. Now, the clinical evaluation really can be done as soon as that horseback athlete steps into your clinic. I love this quote by Bertold Scheer, which says, "Before approaching a horse, the student must understand her body position and the use of her arms and legs. Her body posture must put her in balance and show her the right way to use her limbs for riding and grip. When she understands this on foot, she can get on a horse." From this, we learn that there are certain things about even how a patient walks, how they carry themselves, their posture, their stance, what they're doing with their arms, that may influence what kind of success they have on a horse. Those kinds of assessments we can make within our clinic. We can start with a standing biomechanical assessment. Ask your patient to stand as though they are sitting on their horse. This should be with the pelvis flat or neutral, the feet about shoulder width apart, and with their knees bent about 120 degrees, like they're on the horse. Or, excuse me, about 60 degrees, but they should be at a 120-degree angle. We should be able to see a straight line between the ear, shoulders, hips, and ankles. This places your rider within the correct riding posture. There are some errors of riding posture that can occur. Over here on the left-hand side, we see what's called a vulture neck, where we're all the way forward, or more of a clamped neck, where the neck is stretched backwards. There's also things that can happen within the thoracic spine, where we're overarching the chest or perhaps slumping forward as well, both of which can throw the rider out of balance, can send the wrong message to the horse, and can also contribute to back pain or other pains in the body during horseback riding. We should also examine the lumbar spine. On the left, we have what's called hollow back, where we're overly arched. And then on the right is a rounded back, where we're actually falling back in towards the cantle as well. If you have the opportunity to see your horseback athlete actually on their horse, we should maintain these same principles of posture. Once again, they should be standing straight, such that the ear, shoulder, hip, and ankle are all within a straight line. And we should also see that their elbows, wrists, and the horse's bit fall into a straight line as well. One of the tips that I give my athletes who are having a hard time with posture would be to consider that their spine is on a string that's coming out right through the top of their head, and to act as though someone is pulling on that string, making them sit up as tall as they can. This keeps them from jutting their chest out, or slumping forward, and it also helps them to maintain that good posture. Once again, ear, shoulder, hip, and knee. Now, I have a confession to make. When I was first learning about horseback riding posture, I thought, that all sounds well and good for these English riders, but when we're talking about true cowboys, real horseback riders, that probably don't hold up anymore. You're probably going to see some differences as far as how they set on their horse. For instance, let's look at a team roper, that real natural cowboy that we see. Let's look at this heeler and see. Now, I'm sure he's not going to have that straight line running right exactly where it should be. Huh. All right. So it seems to hold up in team roping. What about this though? Let's consider the tie down roper, that guy that has to come out of the box real hard, go up, rope the calf around the neck, step off in time. Now he is not going to be able to maintain that kind of a posture. Here's our gentleman. Let's draw that line, and well, it ain't perfect, but it's pretty close. Pretty close. I know what's going on. All these horses are broke. What about when you're breaking a horse? I'm sure that posture's not going to work. You're going to get thrown all over the place. Let's look at our rough stock rider, the saddle bronc rider. Now, he is not going to have he has exactly a straight line, my goodness, running right down his spine. So I was humbled, and I learned that, yes, this posture does maintain. And in fact, it's fairly consistent throughout all styles of horseback riding. This posture allows us to have good control over our bodies, be well balanced in the saddle, and allows us to communicate well to our horses and have them understand appropriately. We've talked a bit about the knee angle. Once again, we want our knee angle to be sitting at about 120 degrees. This allows the horseback athlete to stand up in the stirrups appropriately and to maintain good posture and balance. If it is too acute, such as in this rider, where we have about 110-degree angle, or if the angle is too obtuse, about 130 within this rider, this makes it difficult to stand up appropriately in one's stirrups, and also places excess tension upon the quads, the hamstrings, the knee, and the ankle. How do we measure this? How do we make sure that we're at the right spot? A good trick is to simply allow the boot to hang down at the side of the stirrup. If the medial malleolus is at the same level of that stirrup, then we know that our knee angle is likely to be appropriate. So if it's not that ear to shoulder to hip to knee angle or a line that changes very much during riding, why do we see things happening that look different within horseback riding? Why does this jumper look this way on her horse or the breakaway roper? Really what's changing is this hip angle. If you look here, we have that ear to shoulder to hip, but then obviously the ankle stays behind, and that's because the hip angle has changed. The same is true for this breakaway roper here on our right-hand side. The ear, shoulder to hip is in line, but the hip angle has changed such that we're not fully in line with the ankle at this point. But that is because of the demands of what the rider is doing, needing to maintain good communication with their animal and also meeting the demands of their sport. It's interesting to note that some study has been done regarding riding biomechanics and looking at something called acquired asymmetries within horseback riding. If we look at this picture on the left, we will notice that our rider is not sitting entirely straight in her saddle. Her shoulders are cocked over a bit, her hip angle is a little bit off. In this study by Alexander et al., they noted that functional asymmetries are found in the majority of riders. Right-hand dominant riders tend to ride with left lateral thoracic tilt. So right-hand dominant, meaning that you're going to hold your reins more strongly in that hand, and right trunk rotation. This negatively impacts horse or rider performance and may also contribute to low back pain. Now, Hobbs discovered 1 year earlier that this was actually found more often in the experienced and skilled riders, those who knew how to communicate with their horses, and once again noted that increasing risk for low back pain. So what is it that causes this? Grieve and Dyson studied this within a paradigm they called the horse-saddle-rider interaction. At any point within this circle, we may choose to intervene. Let's say that we start with some horse back pain. This causes your horse to move slightly differently, leading to altered spine biomechanics. This then impacts the human biomechanics, such that they start to move differently. This can lead to human back pain, rider asymmetries, and then impacting the saddle movement, which then feeds back to the horse. And then this cycle absolutely continues over and over again. Now, there are ways that we can intervene with any of these steps and break this cycle of horse-saddle-rider interaction such that we can positively impact both pain and function within these horses and athletes. Sometimes saddle styles have the potential to influence this kind of negative interaction. For instance, we talked about the cantle on the back of the saddle sometimes contributing to low back pain. This seems to be the case more with the English or the general usage saddle seen there on the top versus the Western saddle, which is a bit more supportive on the back. However, I've known plenty of old cowboys who complain that their saddle just doesn't fit quite right. And so it's possible, similar to running, to make equipment changes that can positively influence pain and riding biomechanics. We're going to shift gears now and start talking about injury within horseback riding. And this is a quote from a study by Hassan, McLean, and McGreevy in 2010, stating, if serious injury is a likely result of exposure to horses, then the centuries of horse management, training, and education to date appear to have done little to prevent injuries to human beings in their interactions with equids. Riding horses is a ride at your own risk sport. There is very little medical oversight within any of the large equestrian societies, from the Professional Rodeo Cowboys Association to other English sports, meaning that there aren't a lot of doctors looking over your back to make sure things are being done safely, to make sure that people are wearing appropriate equipment, and sometimes that leads to injury. The nature of the sport also plays a big role. So what are some of these factors? Well, first off, it's complicated to play a sport while sitting on something else that's living. The athlete themselves has to learn sport-specific skills to take part within their sport, while also training this other living thing to do the right things while they're slightly distracted. This other living thing is a very powerful horse. It weighs about 1,500 pounds, about 5 times your average NFL offensive lineman, and it runs twice as fast, about 40 miles per hour. Horses can deliver 1,000 newtons of force per kick, and they carry riders' heads 9 feet off the ground. So when they fall, they're falling from a height, certainly. Horses, despite their training, can also be unpredictable, and their size is certainly something to factor in. Once again, we talked about that lack of regulations or safety guidelines, and a study by Srinivasan et al. In 2014 found that only a fifth of horseback athletes wore protective gear, including helmets, which placed them at higher injury risk. The study by Havlik in 2010 pointed out that about 20% of horseback riders will suffer an injury requiring medical care and hospitalization during their riding careers. That's a pretty high percentage. And about 39% of these injuries will occur in children less than 19 years. Horseback riding is the 8th leading cause of ER visits for sport or recreation-related injuries in females. The annual pediatric injury rate among horseback riders is about 21%, with a mortality rate of 2.5%. Horseback riding is responsible for about a quarter of all lethal sports injuries yearly and is the 3rd most common cause of sport-related concussion in adults. And once again, the novice athletes are those who are at a higher injury risk, about an 8-fold increased injury risk. When riding a horse, please try very hard not to let this be you. Once again, very high injury incidence, very high trauma incidence. In this 2010 study, they noted that serious accidents occur about every 350 hours of contact time. Now compare that to motorcyclists, at whom serious accidents only occur about every 7 hours. We're talking about frequent trauma. Once again, the highest injury incidence is in those 4th and 5th decades when most people are taking part, and there's a higher risk for injury among novices in their first 100 hours of riding.
I didn't get that. Could you try again?
In this study by Srinivasan et al., which looked at University of Rochester ER records over an 8-year course, they looked at 80 different patients who had experienced injury in equestrian sports and found that only 2 were using helmets. The mechanism for them was about 55% were kicked or stepped on, and 28% were thrown from or fell off the horse. Interestingly, 10% only described the horse as being startled or fearful. Of neurologic injuries, 28% were cranial vault injuries, which included concussions, and 10% had spinal column injuries. Non-neurological injuries most commonly included thoracic rib fractures. Thankfully, there were no deaths within that population. And lastly, this study by Loader in 2008 looked at an NESS system surveillance of 5,033 ER visits due to equestrian-related sports activities. 66% occurred among women, about 36% occurred at home. The mechanism for most of them was a fall from that horse, with only 22% being either thrown or bucked from the horse. Most common types of injury were contusions or abrasions. The most common site of injury was the upper extremity, and the most common fracture site was the forearm. Once again, we're looking at this common injury incidence around the 5th decade of life, but they also noted the 2nd decade for those younger riders. Somewhat reassuringly, equestrian injuries accounted for only 0.2% of ER visits due to unintentional injury. So can we make it better? That's a lot of trauma that we're dealing with. Once again, the study by Havlik that we've cited talked about using helmets. And if helmets are used, injuries go down 5-fold. So that's a good intervention that we can use. They recommended using more upper extremity protection, talked about the increasing popularity of using vests. They suggested using wrist guards, and then also talked about the boots that are often worn in equestrian riding may protect against lower extremity injury. The McGreevy study from 2010 noted that horse behavior may contribute to injury risk up to about 61% of the time. This included horse breeding for certain traits, or if there were anxiety triggers such as new horses, new smells, dogs at the arena, or unintended rider cues, that perhaps we could decrease the injury risk through a better understanding of horse behavior and better safety practices when interacting with the horse. There's also been some thought about the possibility of maximizing rider fitness and skill in order to decrease injuries. Now, having said all those negative things about horseback riding, there are also numerous studies that talk about the benefits of horseback riding, that this is a worthwhile pursuit for a multitude of reasons. It improves balance, muscular control, muscular coordination. There is a host of psychiatric or psychological benefits that have been described within horseback riding. It does improve functional ability, balance, and gait speed, abdominal and other core strength, gains in agility, and gross motor skills. And interestingly, this study from 2014 decreased back pain. Studies on hippotherapy, as horseback riding therapy is called, have been studied along all age groups, those with strokes, some kind of neuromuscular problem, autism, neurodegenerative conditions. Many populations take part in hippotherapy. It also qualifies as a moderate intensity exercise within the UK. So having said that, are there ways that we can improve the fitness of our riders to improve their performance and decrease injury risk? It's a question that has been posed for many years, but not a lot of research has been done on it. Some important things to consider regarding general fitness for horseback riding. One is that most of the competitions that take place within horseback riding don't last very long. It's not like we're doing lots of water polo, although we do have some horse polo exercise, of course, which are more endurance events. In most horse riding events, though, the competition period is very short. Within rodeo, that may be between 2 to 8 seconds per run. But practice is long. Oftentimes, rodeo athletes are practicing multiple hours a day. So riding that horse for that long period may require some muscular endurance. In a study that we did last year, looking at the fitness of equestrian athletes and their exercise habits, we found that sports-specific exercise for horseback athletes was 7.7 hours per week, with non-sport-specific exercise 3.3 hours per week. So if you're practicing 5 days a week, that's 2 hours each day. A study by Myers in 1992 reported that aerobic capacity was similar to other intermediate activity sport athletes. And lastly, this Sinclair and Ransone study in 2004 encouraged rodeo athletes to train for injury prevention. What kind of training, you might ask? Numerous equestrian magazines and texts have cited the benefits of core strengthening exercises as possible performance adjuncts. There's also been some scientific research looking into this. This 2015 study noted that after an 8-week core strengthening program, dressage riders were able to decrease some of those acquired asymmetries such that they were better balanced on their horses, and it also improved horse performance. Stride length improved by 8.4%. And once again, numerous articles within equine magazines talk about this. You can Google these very simply and find things that are recommended for improving your horseback riding performance or decreasing injury or pain. The problem is we don't know exactly what the best exercises are. The study by Enchef in 2006 looked at activation of 8 muscles during the walking gait cycle and riding, and noted that all muscles were active, but to a lesser extent while riding. Only 3 of the muscles, the rectus abdominis, gluteus maximus, and erector spinae, showed phasic activity, meaning that cyclical activity like you would see with a repetitive movement such as walking or horseback riding, where the horse is moving for you. They concluded that riding may be more effective for developing muscle co-contraction, trunk stabilization, and coordination, rather than actual strength needed for riding. Now, within Sanford Health, we have followed this up with a study called Core Muscle Recruitment during Horseback Riding, partnering with South Dakota State University's rodeo team. And we're looking at 9 rodeo athletes, and we're examining 4 of their core muscles, the rectus abdominis, gluteus maximus and medius, and the erector spinae, and looking to see how active they are during walk, trot, and lope compared with ground-based core exercises. Results are pending, so stay tuned. We'll get back to you on that as soon as we get the data worked out. I like this image because it demonstrates to us that horseback riding is essentially a core exercise performed on an unstable platform. Now consider this tie-down roper leaving the box to chase after this calf. He is elevated out of the saddle. He is stabilized on both sides by stirrups that are simply hanging there. There's nothing fixed on those stirrups except at their most proximal attachments. And that horse is moving between 20 and 30 miles an hour out of the box. But this is not an unsafe or unstable position. He is very stable. The platform is unstable. So when we start to train our horseback athletes, we need to think about training for this kind of explosive movement requiring exceptional stability. Here's an image of a physical therapist doing something similar with a rodeo athlete, and I'd like to see all of us be able to do this on our Bosu balls. This is the kind of stability we're talking about, though, and the kind of unstable platform that we need to be training towards. But how do we start? Once again, there's no validated training programs within horseback riding. However, some studies have proposed some prehab regimens for injury prevention. It seems logical that we would start with closed chain core strengthening exercises, planks, bridges, those things that have us on a stable platform first. And then we progress into more and further unstable platforms or positions. Perhaps we elevate the feet on some therapy bands. Perhaps we start doing push-ups on that Bosu ball. We then progress to more open chain ballistic movements and add in endurance for those long practices. Here's some images that demonstrate some of that progression. For instance, this is someone starting with a typical plank, but then moving to a push-up position. This would be where we would start from. And then we progress to something that required a bit more unstable positioning. In this image, we have a goat tire who is doing some abdominal and lower back exercises using a therapy band with rotational activity. This is a study that proposes an injury prevention program for college goat tying athletes. Once again, on our left, we'll notice that we're highlighting, starting with some things that are fairly stable, some lunges. We'll be doing some supine bridges as well. This would be within the first 2 weeks of starting our exercise regimen. And then we get into tables 7 and 8, where we start to look more at more unstable platforms, such as the single arm supine band pullover, planks with hip rotation, we're going to be introducing some things that require a bit more truncal stability that then prepare that horseback athlete to get back on the horse. So we've talked about injury rehabilitation. What about the concussions that we know we're going to see there? It's important that we apply this same principle of sports specificity that we use within other sports to our horseback athletes as well. We wouldn't ask our basketball athletes to do the same kinds of exercises that maybe our football athletes would do when they are moving back from concussion as well. Their sport-specific activities will look different. And the same thing for our horseback athletes. This was a protocol developed by Wicklund, Foster, and Roy, which for steps one and two looks very similar to what most of our concussion protocols look like. However, when we get into step 3, you'll start to notice that we're doing some practice roping. We're starting to rope the dummy a little bit. We're starting to tie goat and calf dummies on the ground. Maybe we're getting a little bit onto a riding simulator at that point. Maybe we mount the horse and maybe we're just walking around, or we're just practicing mounting and dismounting. We're hanging around the arena just to get used to that environment again. In steps 4 and 5, then we get into a little bit more intense riding, a little bit higher speed. Maybe we're starting to rope the dummy off of the horse at that point, or we're starting to do a bit more intense simulator training at that time, until finally at step 5, we're getting back to full speed equine sport. What are some future directions that we might consider going within equestrian medicine? I think it's very important that we understand how people actually ride. What muscles are we using? What's the physiology like? How fast is the heart rate? Are there things happening with the lungs that we should understand? We need to further characterize those things, and that's what we are hoping to do with our current research. 2, it's important that we understand, are there things that we can do to possibly reduce injury risk within horseback riding? Do those regimens actually work? We don't have a lot of prospective studies saying that if a horseback athlete performs those prehab regimens, will they have reduced injury risk? That's something that we should bear out. And 3rd, some of you may have been thinking, I have athletes that have strong requirements for core strength. Maybe that's your pole vaulter. Maybe that's your swimmer. I'd like to know how I can help them be stronger without them continuing to train ad nauseum with some of those sports. Could riding on the back of a horse be a cross-training mechanism? That's something I'm very interested in, and I hope to be able to investigate here in the coming years. I'm looking forward to it. So in summary, we've talked about how equestrian athletes constitute a broad range of styles and ages. This is an ages and stages sport that can be done all across a lifespan. Now, there is inherent risk for injury during equestrian sports. Expect trauma when you're covering one of these sports. When injuries happen, they usually happen in a big or a bad way, so be ready for that. However, horse riding can provide physical and psychiatric/psychological benefits. There are numerous studies that show the benefit of getting on a horse. We can make a proper biomechanical assessment in our clinic, and we can also look at that within the arena while we are covering sporting events. And lastly, we know that proper biomechanics and core strengthening can enhance horse rider performance and possibly make a difference with injury risk. And that's where we can come in and where further research can make a difference in this field. Please feel free to review my references. I thank you so much for the opportunity to talk about this small corner of the sports medicine world that means a lot to the participants. I hope you'll take this back to your clinics. Feel free to contact me with any questions or concerns. I look forward to our Q&A. And once again, thank you very much for your attention today. This is Dr. Miller. Thank you very much for joining us today. We're going to do a couple of CAQ questions here. Is everyone able to hear me okay? All right, feel free to put your answers to this in the chat. When performing a biomechanical assessment of a horseback rider in clinic, posture is best evaluated using alignment between which structures? A, the bilateral shoulders, B, ear, shoulder, hip, and ankle, C, chin, sternum, and belt line, or D, hip and knee. Okay, very good. That's exactly right. Yep. So remember, we're looking for that straight line between the ear, shoulder, the hip, and the ankle. That will help us make sure we're using good posture. What I like about this too, that I didn't mention within the lecture, is that this is really an athletic stance minus kind of the forward lean or being up on the balls of the feet. When you look at your basketball players, your football players, and you ask them to get into their stance, they will get into this stance with just a little bit more hip flexion. So really, we're just setting that the upper body backwards just a little bit so that we can stay nice and straight and evenly balanced in the saddle. But otherwise, it's a very athletic stance. All right, question 2. The first phase of a training program for horseback riding injury prevention would most likely include which of the following exercises? A, planks and bridges, B, upper extremity resistance training, C, riding a stationary bike, or D, jumping jacks. Excellent, very good. Yes, we're starting with those closed chain core exercises first, and then from there we're building to more explosive or ballistic exercises on an unstable platform. Very good. Number 3, which of the following factors contribute to injury risk in equestrian sports? Mark all that apply. A, frequent lack of medical oversight. B, unpredictability of horses. C, inexperience and or young age of participants. Or D, infrequent use of protective equipment. All right, pretty good. So this one's actually in all of the above. So all of these things can contribute to injury risk in equestrian sports. Especially the inexperience and your young age. Some of the studies have shown that people within their, first 100 hours of horseback riding or who are in their second decade of life are more likely to get injured. Number 4, and last one, which of the following is a benefit of hippotherapy? Mark all that apply. A, improved psychiatric measures. B, increased upper extremity strength. C, improved agility and gross motor skills. And D, decreased concussion incidence. Very, very good. Yep, so we are certainly going to improve psychiatric measures, and there is improved agility and gross motor skills. B is a little bit tricky in that the upper extremity is not benefit, but the lower extremity is. And you're right, horseback riding is certainly an increased concussion risk. All right, very, very good. Thank you, guys. Excellent.
Thanks, Dr. Miller. That was great. I know we had a kind of an intro to equestrian with a couple lectures at AMSSM, but it was really nice to get a deeper dive into it with your lecture. And I also liked the return to rodeo protocol that you included. So thank you for that. We have a question in the chat from Heather Bergeson. She said, thank you. Are there any studies that show inflatable vests reduce injury? And can you comment about the concern that they may spook the horse or may cause more injury to the rider or the horse?
That's a very interesting question. I'm actually not aware of any studies that look at inflatable vests is in the wilderness medicine sphere with avalanche safety. I could certainly see that increased use of vests may decrease the risk for thoracic injury, and especially within the rough stock events like saddle bronc riding and bareback riding, you see a lot more of those rodeo athletes using protective vests. Would they spook the horse? I guess it depends on what kind of horse you're riding and what kind of training you have. In fact, when these horseback athletes are training their horses, lots of times they will use some kind of a loud gunny sack or a plastic flag or something that kind of desensitizes the horse to hearing sound or to that rubbing kind of noise that may be off-putting for them. And so I think that it would depend upon the kind of arena that you're riding in, what the environment is like, and what you're wanting your horse to do. I could see how it might be helpful, but I think you'd have to find the right kind of horse in the right kind of setting.
Thank you. Is there a kind of typical age that, or how young someone has to start in order to go professional with equestrian?
Very good question. I would say the vast majority of people who are professional equestrian riders probably start when they're younger. They probably start within that second decade of life. It's hard to start younger than that, though, because these are such strong animals, and it's just really kind of hard to control, and it's hard for them to have the confidence that they need to make the horse do what they need to do. And so that second decade of life between ages 13, 14, 15 seems like prime time. But there's not really a time that you couldn't start. Within a lot of the hippotherapy studies that have been done, they've even used people into their 80s who are starting to do therapy riding. And so there's no age limit, but to be a pro, it's probably best to start young, but not too young.
Yeah, very cool. We have a question from Jackie Meyer or Mayer. As a competitive alpine racer, I grew up encouraged to ride, especially to post, as this was supposed to be protective against knee injuries, primarily ACL related injury. In your experience, is there any evidence that riding protects against such injuries?
That's a fascinating question. I'm not aware of any research that shows that. However, when you think of ACL protective exercises, particularly the Nordic hamstring exercise or such things, the kind of motion that you're doing on the horse, where you're riding and then slowly lowering yourself back into the seated position, that's utilizing all of those muscles. And so you're building knee stability, you're building pelvic stability, you're certainly strengthening your hamstrings, really strengthening your adductor muscles as well. And so I'm curious to find that out. I think it'd be really interesting to do a prospective study of that and see if you were able to decrease ACL injury risk or hamstring injury risk.
Yeah, I think that's very interesting. Jackie, you should do a study if you need a
Yes.
coach idea.
Let's talk.
And then one more question. So part of the mechanism of injury in some cases you said is horse behavior. Is there any tips you recommend for the events where you don't necessarily get to go with your own horse? Like in collegiate equestrian, there's at least some events where they may not get to use forces that they're familiar with.
Oh, I like that quote by Bertold Schirg that we shared, that the rider needs to understand where they are in space themselves. They need to understand the use of their own limbs. Especially in equestrian riding, there is a taught I don't know if protocol is the right word, but there are certain principles of riding that are fairly universal as far as how to encourage the horse to move in a certain way, how to put the horse at ease. Learning those things on your own horse will set you up for better success going forward. And then knowing those aspects of horse behavior in terms of not making sudden movements, being just mindful of how you're behaving around the horse really can increase your horse's behavior for success too.
Great. Thank you. And then we just wanted to let people know, for those who attended the 2024 annual meeting, Dr. Kelly Ryan gave a talk on equestrian medicine during session 1 on Saturday, and it is available for playback on the annual meeting website, along with all the sessions from the conference. And normally we have a survey that all of you in the audience can fill out for feedback. We didn't have a chance to update it today, but we will have a link to it on the YouTube video when it is uploaded. And thanks again, Dr. Miller. That was awesome.
My pleasure. Thank you so much for letting me be a part of it. It's a great pleasure.